Okay, we'll go ahead and get started with today's webinar about laboratory self-inspections. So we're going to start off by discussing the reasons for doing self-inspections. Then I'll talk about how to conduct self-inspections and the key elements for them. I'll be showing you how to use EH&S's new self-inspection tool. And then we'll talk about ways that you can customize the self-inspection process to make it as effective as possible. So let's start by discussing the whys. Why do you need to do self-inspections of your lab? First of all, OSHA and Washington State administrative codes mandate self-inspections of workspaces to be done by the responsible party. In the case of a lab, this is the PI or chemical hygiene officer. Secondly, it is a requirement that is stated in the lab safety manual as being part of your chemical hygiene plan. The lab safety manual is a UW policy document. In addition to the regulations and university policy, there are a number of beneficial outcomes that are reasons for doing self-inspections. They allow you to get different insights from inspections conducted by EH&S. They make it a routine to review and update safety practices and trainings. They're also an opportunity to verify that lab policies and practices are being maintained and followed. They give you a chance to confirm that changes you've made to your policies or practices are being sustained and are working well for you. And they're also a chance to incorporate any new personnel, equipment, activities, or hazards into your documents, trainings, and practices. So how should you set up your practice of doing lab self-inspections? The minimum requirement is that you conduct a self-inspection once a year. However, if you have a lot of turnover in the lab, such as if you have students or visiting scientists conducting projects, or if your work involves a lot of disciplines and is not routine, you should definitely consider doing inspections more frequently. Perhaps it would be beneficial to do it once every quarter or at the start of each new year. This will help issues to get addressed in a more timely manner. If you are only conducting one self-inspection per year, you should do it at least several months before or after your EH&S survey. This will prevent it from being redundant and make it more effective. If you are conducting self-inspections on a quarterly basis or more frequently, then timing it based on your EH&S survey is not as important. Inspections should be done in a timely manner, meaning that you should complete the whole thing within several days. Try not to drag it out and risk losing track of what has and hasn't been covered already. Keep consistent documentation practices for your self-inspections. You are required to keep records that you've conducted them. Paper or electronic format is fine. Find a format that works best for you and your group. Make sure to include what was checked, what was found, the date that you conducted the inspection, what your corrective actions will be, and when they are completed. When it comes to what elements to include in your inspection, there are ones that should always be covered, and then there may be more specialized elements that you include based on the work currently being done by your group. In the next few slides, I will discuss the elements that should always be included. We will start with items that are part of your chemical hygiene plan. You want to check that your lab safety manual is the current version and is accessible to all lab members in the spaces in which they are working. You want to review that training records are current and all necessary trainings have been documented. You should check that you have SOPs for all the hazardous chemicals and materials in use, that your SOPs are complete and that they're accessible. Review PPE and hazard assessments to make sure that they are complete and current for the work being done right now, and review them for any changes that need to be made. You also want to make sure that you have authorizations for hazardous materials and practices in use in place. This may be something like a biological use authorization or authorizations for radioactive materials. Review of PPE practices and materials is an important topic for self-inspections. Check that PPE practices for all current activities have been assessed. Make sure that there is documentation that all your lab members have been trained on your PPE practices. Check to see if your PPE practices are being followed by people working in the lab. Check that your PPE is an adequate amount and is maintained in good condition. The Lab Safety Manual outlines policies that pertain to all labs, but each lab should also have their own set of policies that cover work practices and expectations specific to their space and materials used. This can include things like acceptable times of equipment use, if work can be done alone, and lab-specific trainings. It's important to document your lab policies. You also want to have documentation that lab members have been trained on these policies. Check to see if the policies are being followed by the people currently working in your space. Emergency procedures and floor plans should be posted in all your workspaces. And food and drink should never be consumed in the lab. Chemical management is a key topic for lab self-inspections that has multiple aspects to it. The best starting point is to make sure that your chemical inventories are accurately listed in MyChem. Then check to see that your caution signs are generated from the current inventory and that you have them posted at all entrances to your lab spaces. Check to see if chemical containers are still in good condition and stored in the appropriate locations. And make sure that old and unused chemicals have been removed from your lab or that you have a plan in place to dispose of them appropriately. As you conduct your self-inspections, you should be walking through all the rooms used by your lab. When you go into a room, check to make sure that there is access to first aid and spill kits as needed. People should not have to go into public corridors to access rooms where kits are stored. They should be readily available in the workspace. Check to make sure that all your hazards are appropriately labeled and stored. Ensure that storage units are also clearly labeled. This includes chemical, biological, radiological, and physical hazards. You also want to make sure that your hazardous waste is appropriately labeled and contained. And check to see if the appropriate hazards are included on all your caution signs. Include checks of your laboratory equipment in your inspections. This is very important if you do not have service contracts and are the only person ensuring that the equipment is being well maintained. Check to make sure that people in the lab are following policies and best practices for using equipment, including items like fume hoods and biosafety cabinets. Check that equipment with physical hazards are properly guarded and secured. Check to see if electrical safety practices are being followed. And check that your emergency equipment is free and clear and easily accessible. This includes items like eye washes, showers, and fire extinguishers. The chemical hygiene officer or lab manager is never the housekeeper for a lab. When you review housekeeping practices in your lab, it is a good assessment of whether lab policies and practices are effective and being followed by everyone. If you find housekeeping issues, then you may want to review what your lab policies are, update them, and do a training for your group. Check to see that workspaces are clean and uncluttered and that there is sufficient space for work to be done. Check to see if storage spaces such as freezers and cold rooms are well organized and maintained. Check that your waste streams are appropriately managed. This includes chemical waste, biological waste, and radioactive waste. Make sure that there are no legacy items such as surplus equipment or old chemicals taking up space or cluttering your work areas. And make sure that aisles and exits are always clear. Now that we've covered the key subject areas for self-inspections, I'm going to show you how you can use EH&S's new online self-inspection tool. Go to the Research and Lab section of the EH&S website and click on the page for lab safety. As you scroll down, you will see a list of survey-related tools and resources. Click on the link for the Laboratory Safety Dashboard. This will lead you to the portal for your dashboard. In July, we launched a new version of the dashboard for PIs that includes an online self-inspection tool. It is located in the top right-hand corner of the dashboard. This tool is basically an online version of the laboratory safety checklist used by EH&S to conduct lab surveys. If you are unable to access this tool or prefer to use paper checklists for self-inspections, you can download and print out a copy of the checklist from the lab safety webpage. After clicking New Self-Inspection on the dashboard, you will come to an introduction page. Click Start to begin your self-inspection record. A list of all the questions on the checklist will be displayed. Each question is answered with yes, no, or not applicable. There are spaces next to each question where you can list your findings and corrective actions needed. When you are done answering all of the questions and filling in the appropriate comment boxes, click Save. The inspection must be completed within 72 hours for the inspection to become a permanent record. If you have multiple lab locations, the lab safety dashboard will save the self-inspection reports completed for each lab, and the last 4 will be visible on the dashboard. You will be able to print out a PDF of the report to keep it for your records. If you need information about expectations and requirements for a question on the checklist, you can visit the Lab Survey Checklist Explanations page. The address for that page is listed here. You can also locate it on the Lab Safety webpage or through the EH&S's search function on our website. The last part of this webinar will cover ways that you can customize your self-inspection to make it as effective as possible for your lab. You can customize the way in which you conduct your self-inspections in terms of frequency. We've already talked about this a little bit. You're required to do them at least once a year, but there are a number of reasons why you may choose to do them more often. You may have just one person conduct the inspection, or you may choose to have a group of people do them. Perhaps it would be more useful to have people with very different functions in your lab conduct the self-inspection together. You may choose to have the same person or group of people do the inspections every time, or you may rotate the assignment. You should think about how you want to communicate the results of the inspection. Will they be discussed in a group meeting? Will they be posted or printed out for review? Will you send them out in an email? If you share resources or spaces with other labs, you should think about collaborating on your self-inspections. Perhaps you can decide to inspect each other's labs and compare notes. The other way to customize your inspection is by what gets included. If you have unique hazards or pieces of equipment, you definitely want to include them. Perhaps you have equipment that was built by your lab. Only you understand the features and requirements of that equipment and what should be maintained for safety. If there have been incidents or accidents in the lab, think about the corrective actions taken and find ways to check that those actions are being maintained by everyone in your lab. If there is a recurring issue in a particular space or type of work being done, think about checks you can add to your self-inspection to make sure they don't keep happening. You are the person who best understands the work and equipment present in your lab, and you know what issues come up the most frequently. Use that knowledge to customize your self-inspection so that all areas of concern and risks are being checked and that they're being checked often enough for issues to get corrected before they get out of hand. At this time, I can take any questions you might have. You can type them into the chat box and I will answer them as I receive them. Thank you for joining me for this webinar.